We will be talking about sleep apnea. There are 3 types of sleep apnea: central, obstructive, and mixed. The most common for sure is obstructive, so that's what we're going to be talking about today. It happens during REM cycles or some REM cycles during sleep. In this time, the inhibition of muscles around for inspiration and expiration kind of relax during that type of sleep. So what happens is when the air is coming in and all that, and then the muscles are relaxed, there's actually a collapse of the trachea right around there, and it's just unable to get the air back out, which is why the obstructive comes in, and then there's something blocking it. Once that happens, then the sympathetic nervous system is stimulated and some signs and symptoms come into play. Some of that is because of that stimulation, that it's fight or flight, your body is trying to respond, but because it's still obstructed, your body's trying to breathe more. So then there's thrashing of the limbs is one of them, and that's just throwing it up, the body trying to do whatever it can to get you to breathe. Another thing that happens during this is it's in episodes. It's not just once per night, it's multiple times per night for multiple nights in a row. So it's just, this happens multiple times. The person will wake up, disrupt that sleep, and then not get enough sleep and get enough air into, or back out in that proper ventilation. The incidence on sleep apnea is that 70% of those people that are diagnosed with this are obese, and our thinking behind that is just the actual muscles themselves relax, and that's what they use to breathe more. So it's just more common with that. And then facial malalignments, our book talked about kids or anything like that with Down syndrome, just different structures have different way of breathing air in, and then that kind of muscle relaxation more and not perfect muscles there, it kind of happens a bit more. And then all the way with signs and symptoms, we have that snoring, and right following snoring is the breath cessation. They'll snore as they breathe in, but then the trachea will collapse, causing them to pretty much stop breathing. We already talked about the thrashing of the limbs. And then another one that you can see is daytime drowsiness. As you can see them with the episodes, they're waking up multiple times during the night, and then all this causes the daytime drowsiness, and then just not getting that right enough sleep and amount of air in.
So some of the diagnoses for sleep apnea that are common are to do it in a laboratory setting. So this is a sleep lab testing. So basically what they do is they hook you up to almost like a spirometer type machine, and it's on through the whole night when you're sleeping. It's typically finished within one night. So to read, what they're reading is the apnea episodes, or the amount of times you actually cease breathing. And for a diagnosis of mild sleep apnea, it's 5 to 14 apnea episodes per hour. Anything above that is going to be a severe episode and will require immediate treatment. So for the mild episodes, sometimes they won't go to serious treatment right away, but may think about it in the future. And some of these treatments are conservatively first with weight loss. Next in line would be a night oral appliance. This is similar to a retainer, which would keep your lower jaw usually more in front and allow more airway to get in, opening up that trachea, which is closed off. And some of the more common treatments for severe sleep apnea is a positive air pump, or a CPAP machine it's called. Basically it goes on your nose and sometimes your mouth during sleep, and it's basically an oxygen machine allowing oxygen to get in forcefully, breaking through that closed trachea and allowing sleep to be better. Patients who have this will report decreased drowsiness, much better sleep, and actually their partners actually benefit from it greatly also. So some of the long-term effects for sleep apnea, there's a lot of cardiac effects. But first would be cardiovascular disease, heart failure. This arises from the lungs not being able to get that air in at night, the sympathetic nervous system being stimulated over and over and over again every single night. This will cause hypertrophy of the heart, usually atrial, and this atrial hypertrophy could lead to less blood getting in, less blood going out, and eventually a heart attack or heart disease. You could also see hypertension and arthrosclerosis. So with that arthrosclerosis, we're going to get a buildup in a vessel, which could eventually break off and clot due to the lack of oxygen every single night. That break off could cause a stroke or could go to the heart and cause MI or coronary artery disease possibly. So there's neurophysiological morbidity also and arrhythmias. And an interesting fact our book noted was that the death rate is 3 times more in individuals for a cardiac disease who had sleep apnea versus those who did not have a diagnosis. So if you're suspecting anyone out there does have this sleep apnea, they should go get checked. It's just a one-night check and could affect them for the rest of their life. Some similar diagnoses to sleep apnea is bronchiolitis. This is obstructive mucosa of the bronchioles. So basically the bronchioles are swelling, the mucus is obstructing the air, you're not able to get the air out. And it's kind of the same cascade as sleep apnea has, eventual heart defects if it lasts too long.